Hi guys, Dr Dona, specialist plastic surgeon. Today I'm going to talk about breast lift surgery, and this is in fact the first of 3 videos I have on this particular topic. In this video I'm going to discuss the assessment and things I need to consider when planning your surgery. Now, a breast lift, especially if combined with an implant, is the most difficult cosmetic breast surgical procedure to perform, and junior or inexperienced surgeons have troubles performing this surgery well because there are so many issues or variables that need to be considered. And the greater the number of variables you have to consider in an equation, then the greater the difficulty in solving that problem. So why is that, and what am I talking about? Well, a breast lift procedure simply means lifting up the breast tissue and nipple area to create a better breast shape. This can be done with or without the use of an implant. Sounds simple, but there are numerous things that I must consider before contemplating and planning a surgical breast lift. However, the basics involve a formal assessment of the chest and breast as per standard breast augmentation. But in addition to all the planning typically required for breast augmentation, other vital issues need to be considered to determine how to work with those variables to give you the best result. And, of course, to determine results that are realistically going to be possible. Now, some of the variables I need to assess include your skin quality. Is the skin loose with many stretch marks or thick and firm without stretch marks? Often the skin in someone requiring a lift has lost much of its elasticity. Thin skin with loss of its elasticity means things have a much greater risk of re-sagging. Also, the degree of sagging of the breast and how much does the nipple need to be lifted. Is it sitting below the level of the lower breast fold, and by how much? The lower they are sitting, the greater the degree of difficulty in lifting it up and keeping it up. The nipple direction. Is it pointing downwards, or is it just droopy but still pointing forwards? And the skin distance from the nipple to the lower breast fold. If it's too long, that's a slight problem. But if it's very short, that's potentially a much greater problem. Nipple areola size. Now, a very large areola size can be a potential problem with the surgery and the planning. Now, breast lift quality is obviously very important. Now, is it firm or is it soft? Soft breast tissue is very difficult to handle and typically always wants to sag. And another extremely important thing to understand is that soft breast tissue will always be soft. Nothing can be done to make soft breast tissue firm again. Surgery simply redistributes or repositions the breast tissue. And even with an implant, it will still be soft. And like I said, it has a much greater risk of re-sagging. Think of it like sculpting. If you have a piece of timber and you sculpt it, then it's going to remain the shape that you've shaped it. Or you sculpted in rather. However, if you're sculpting or shaping a bit of jelly, it's not going to maintain its form. It's going to sag. Now, breast tissue volume is another vital issue. The greater the amount of natural breast tissue, the greater the degree of difficulty with the surgery. Lifting a large volume of breast tissue and trying to keep it up is difficult, and indeed often not even possible. The more natural weight, the more that gravity is going to affect it. Furthermore, the greater the amount of natural breast tissue, the greater amount of changes that are going to occur over time. Having a lot of breast tissue can be considered a blessing when it's all sitting right, but over time it's going to change far more compared to those with minimal breast tissue. How detached your breast tissue is from the chest wall muscles is another issue that's often difficult to explain. But basically, sometimes the breast tissue is very mobile with loose attachments to the underlying muscle. And effectively your breast tissue is sliding over your chest wall. This makes the breast tissue extremely difficult to handle and therefore difficult to effectively lift. What are your desires? What look are you after? And of course, the final variable, which is impossible to work with, is of course time. How much your natural breast tissue changes after surgery is based on your genetics and personal circumstances. These things are impossible to know and predict. Oftentimes, women will achieve an excellent result early after surgery, but within a relatively short period of time, their breast has continued to sag or change. This can be due to natural breast tissue changes, volume fluctuations, hormonal changes, weight changes, etc. And these things will negatively affect the results. As stated previously, The greater the number of variables an equation has, the harder it is to solve that problem. And that is why the problem of breast lift surgery is so very difficult. There are so many variables involved. And perhaps the hardest thing for patients to accept is that they are needing a breast lift because they have weak and poor quality breast tissue and skin, which is sagged. Yet that same breast tissue and skin still exists after surgery, and therefore it's still wanting to sag. No surgery and no surgeon can change the quality or consistency of the breast tissue and skin. All the surgeon can do is try to reposition and sculpt the breast tissue on that day of surgery. So as you can appreciate, there are numerous natural anatomical variables that I must assess and work with when planning your breast lift surgery. Of course, due to the person's pre-existing breast state, it's often not possible to achieve the results that person desires. And this is when painting a clear picture of realistic expectations is required. Anyway, I hope that gives you some insight into the issues that I need to consider and work with when planning your breast lift surgery. In my next video, I'll cover the different types of surgical options available to you. Thanks for listening.